Well, this isn't the video we were planning to make, but here we go. Yesterday, Green's co-leader, Marama Davison, announced that she had been diagnosed with early-stage breast cancer. So I would just like to open the video, sending my love and support, and encouraging people to go and get checked, and to say that I support Marama Davison all the way and applaud her for standing up for this great cause and using her public profile and platform to encourage people to get out and get checked, even through her own diagnosis. Unfortunately, it's not all positive with breast cancer diagnosis in New Zealand. And to talk a bit more about that, here's Paul.
Hey Blake, thank you for that. And I want to echo Blake's and thousands of other people's sentiments from around the country in wishing Marama a speedy recovery and sending her much aroha at the moment for her and her whānau going through a clearly trying time. I can't wait to see you all better, back on your feet and back in the house. If you had a chance to see the press conference yesterday, there was actually a sort of theme to some of the questions that came through around the inequitable outcomes of Māori when it comes to our healthcare in this country. And it's not a new concern. Most of the research that's been done in the last decade has shown the same thing. Outcomes for Māori are far worse in our healthcare system than for non-Māori, and there's a number of factors behind this. One of the big ones is, well, racism, both systemic and personal. For example, did you know that 42% of all people needing to see primary healthcare providers within a 24-hour period are Māori, and only 25% of people who actually get those appointments are Māori? And that might be down to just timing or scheduling or reticence to actually get in there. It might be high peak times like cold and flu season. There's a number of factors that come into play. But systemic and personal racism is one of the factors that also plays into that. And if this is something that's happening quite often enough for it to be the results of a fairly large-scale study, that shows that people are not getting the service that they need. If you go to a cafe and you get terrible service every time you go, you're going to stop going to that cafe. It's the same with primary healthcare providers. If you feel like you're being treated like crap the whole time, that you're not being treated as important, you're not going to go back to that particular healthcare provider. And those systems are already really, really stretched. And this is where things take a bit of a dark turn. You see, our primary healthcare providers get a number of different payments from the government. There's fee payments and there's supplements for other things that they're doing. There's a whole bunch of money that basically gets funneled through our primary healthcare providers for when they see patients. When they don't see patients, they obviously don't get paid for it. And for the number of Māori who don't get seen when they need to be seen by primary healthcare providers, that actually saves the government $49 million a year. But at the flip side of that, that means that you see a much bigger increase of the number of people needing to use hospitals for emergency services or for ongoing issues that could have been taken care of earlier. That bill is $863 million per year. It's horrible because the system is inequitable. It's not like you can say everybody gets the same treatment so you get the same outcomes, because not everybody is starting in exactly the same position. Years and years of people being put down or being put to the back of the line or not being given equitable treatment in primary healthcare leads to longer lasting issues, both in terms of healthcare at the hospital end, but also in terms of the attitude that people bring towards going to a doctor. I'm not going to go to a doctor if I can absolutely help it because of how I was treated last time. And that's really not good. And do you know how that could have been fixed? Well, the research was actually pretty clear. They needed to set up something like Te Aka Whai Ora, an independent Māori health authority that specifically was tasked to work with both the Ministry of Health and local Māori health providers and try and change that attitude and get more people focusing specifically on Māori health to basically let them move up to the starting line that everybody else moves up to, so that those outcomes at the other end are far more equitable, so that one group of people in particular aren't more negatively impacted by everything that's come before them. And it would have been absolutely brilliant to see that go ahead. all of the research said it was a really, really good idea, and one of the very first things that this government did when they got in was cancel it. So we didn't even get a chance to see if it was going to work. And then when people kicked up a fuss and were like, hey, we're going to go to the Waitangi Tribunal about this, they rushed it through Parliament so that the Waitangi Tribunal couldn't even have a say. So yeah, when you see that press conference and you hear questions being raised about the inequitable outcomes towards Māori within our healthcare sector, that's what this is referring to. Terrible, terrible decisions from this government that are not going to fix those inequalities in any shape, way or form, haven't helped anyone in any shape, way or form, but hey, they might save an extra $50 million a year on primary healthcare supplements because people are still not going to go to the doctors if they don't feel like they're going to be treated like humans.